I'm Enuma Kelechi. This is my checklist. Okay. I'm coming into the patient's room. Why coming into the patient's room? I'm checking the environment to ensure the environment is safe for the patient. I'm checking the position of the patient, if the patient is in the right position. I'm checking the equipment to ensure the equipments are functioning appropriately and they are well freezed. And I'm also checking my patient to check if my patient is alert or confused. So I'm going to be doing a GIT assessment, gastrointestinal assessment. And for this assessment, I'm going to be using a stethoscope. I'm going to be using a measuring tape. I'm going to be using a flashlight on a pen. I'm going to use a tongue depressor. This is going to stand as my tongue depressor. Hi, Mrs. Susie. How are you today? I'm Nurse Kelechi. I'm going to be your nurse today. Please, can you confirm your name? Okay. And please, your date of birth? Okay. Okay, Mrs. Susie. I'm here to do a GIT gastrointestinal assessment, which has to do with accessing your abdomen. Okay. Before I start, do you have any pain? Are you experiencing any pain anywhere? Are you having any discomfort? Okay. Yeah, I would like you to tell me in case there's anything I could attend to you for, in case there's anything I could help you out with before I proceed with the assessment. Okay. I'm going to be asking you some questions regarding your abdominal health. This is to help me get some history, your past history and your present history about this abdomen. Have you noticed any change in your bowel movement so far? Maybe in the last couple of days? Okay. Do you have any difficulty swallowing? Do you notice anything? Do you find it difficult to swallow food? Okay. Or most times does it seem as if you're choking while eating? Okay. How often do you eat? Do you normally eat well, or most times you lose appetite? Or do you eat just in the morning, or you eat 3 times a day? What's your meal like? Okay. And also, is there any particular diet you're allergic to, and how do you react to the allergy? Okay. Also, are you on restricted diet, or are you on any special kind of diet? Oh, okay. Is there any medications you're on that you like to tell me about? Okay. Are you currently having any abdominal pain, or are you having nausea or vomiting? Have you vomited today, or you feel like vomiting? Okay. And how often do you use the washroom? Like, do you poop every day, or once in a week, or 3 times a day? How often do you poop? Okay. Yeah, in this assessment, I'm gonna be doing an inspection for you. I'll be auscultating, I'll be percussing, also I'm going to be palpating. Okay. Yeah, first of all, I would like to start with the inspection of your oral cavity, and that will start from the lips. I'll be checking your lip color, checking if it's pink, or if it's dry or moist. Okay. And also I'll be checking your gum. I'll be checking if your gum, if it looks healthy, if there's any bleeding, if there's any bruises or anything around it, anything that looks unhealthy. Okay, I'm also going to be checking your tongue. Is your tongue, I'm going to be checking if it's dry or moist or pink or white or has some form of discolorations. Okay, also I'm going to be checking the back of your tongue, like towards your throat. I'm going to be using this tongue depressor on you. Okay, I put the tongue depressor, and please can you say ah from me? Okay, I'm checking the back of your throat. I'm checking the tonsils to be sure to know if they are inflamed or not, or if they're in a good condition. I also like to stimulate a gargle reflex on you. Do you mind me going ahead with it? Okay, I'm gonna be putting my tongue depressor. Okay, towards your throat. Okay, and if the patient is able to gargle, to check how the patient is able to gargle. Okay, and I'm going to be checking your mucous membranes to check if they are intact. Are they moist? Are they pink? Are they dry? Okay, okay, they look good. Okay, right now, Mrs. Susie, I'm gonna be proceeding to your abdominal region. Do you mind me proceeding? Okay. First of all, I'll be inspecting your abdomen. Can I lift your shirt a bit? Okay, I lift the shirt up to the up region, up to the breast region, and this one down to the suprapubic area. Okay, yeah, I'll be checking your abdomen. I'll be making some observations, inspecting. So right now I'm looking at your abdomen to check if there's any scars or any lesions, or if there's any distension. Sorry, I'm gonna bend over this way to check your abdomen. Okay, I'm checking if they look round or flat or distended. Okay, and also I'm going to check if there's any discolorations. Okay, does it look good? Okay, I'm also checking the contour and the symmetry. Are they equal? Okay. I'm also checking for the pulsations on the abdomen. If there's any pulsation, if I can see any pulsation, and also checking your accessory muscles if it's moving or anything. I'm also checking if I can spot any peristaltic movement. Okay, yeah, Mrs. Susie, I'm done with inspecting your abdomen. I'll proceed with my auscultation. I'm going to be auscultating for your bowel sound and for vascular sounds. Okay, right now I'm gonna be dividing your stomach. Do you mind? Okay, gonna be dividing your stomach into 4 regions. We call it the 4 quadrants, and this happens to be your right lower quadrant. This is your right upper quadrant. This is your left upper quadrant, and this is your left lower quadrant. So right now I'm going to be auscultating your abdomen, this 4 quadrants, and for each auscultation I'm doing, I'm going to start from the right lower quadrant, which happens to be here, and I'll be using the diaphragm of my stethoscope to listen for the bowel sounds. Yeah, normally most times the abdomen could have some bowel sounds, and most times they could be abnormal. We can have some hypoactive sounds and hyperactive sounds, and I'll be listening to the abdomen with my stethoscope, I'll be using the diaphragm of the stethoscope. So I'll start from the right lower quadrant, which happens to be here. I'll listen for 5 to 30 seconds if I'm going to hear any sound. I'll move to the right upper quadrant to listen for sounds. 5 to 30 seconds. I'll move to the left upper quadrant if I can hear any sound. I'll move to the left lower quadrant. And most times there could be sounds, hyperactive or hyperactive. Yeah. And if I don't hear any sound, I'll listen for 5 good minutes. So if there's no sound after 5 minutes, I'll document that there is no bowel sound. Yeah, moving in the clockwise direction. And most times we have hypoactive and hyperactive sounds. Hypoactive sounds comes when maybe the stomach is recovering maybe from procedure or is in a quiet moment, like most times when you come out from surgery before the bowel returns to its normal functioning, there's some the sounds are hypoactive. Also, when you're constipated, the sounds happen to be hypoactive. And hyperactive sounds can be heard when you're having diarrhea, like when the bowel movement, when there is excess bowel movement is fast. So that's what happens with hyperactive sounds. And right now, I'm going to be assessing for your vascular sounds. I'll still use my stethoscope and I'll still auscultate the 4 regions, okay? Not the 4 regions this time. I'm going to have some other regions, some other parts to auscultate. Yeah, here is one of the places, the parts. This is the costal arc, just right below the sternum region, just right the midrib here, and below it, right below it, we have and here the costal arc. We are listening to the abdominal aorta. Right below it, we have the renal arteries. And at the level of the umbilicus, this is the umbilicus, right below the level of the umbilicus, we have the iliac arteries. And right at the level of the groin, close to the suprapubic region, we have the femoral arteries. So these are the points I'm going to listen for the vascular sounds. And in listening for the vascular sounds, I will use the bell of the stethoscope. This is the bell of the stethoscope, okay? So I'm gonna put it this way. I'll still move from the right lower quadrant in clockwise direction to listen for the vascular sounds. I'm going to listen for 5 to 30 seconds. I'm listening to the right lower quadrant. No, sorry. I'm listening to I'm listening to the 6 cardinal points. So I'm going to start from the abdominal aorta. I'm listening for 15 to 30 seconds. Next one is the renal arteries. So I'm going to be listening bilaterally. This is the left, this is the right. I move to the left, listen for 15 to 30 seconds. Move to the right iliac artery, listen for 15 to 30 seconds. Move to the left iliac artery, listen for 15 to 30 seconds. Move to the femoral arteries, the right femoral artery. Yeah, most times sounds could be heard around this region. It could be a bruit. A bruit is a sound, is a whooshing sound, is an abnormal turbulent flow. And when I'm listening to this to those places, the normal one seems to be like a pulsations, like the pulse, like it has a pulse nature, but the abnormal one seems to be a bruit, like abnormal turbulent flow. So that's what I listen to, but everything seems to be okay. And next one, Mrs. Susie, are you okay? Should I proceed? Is there anything you'd like me to do for you? Do you have pains anywhere? Okay. I'm gonna be percussing the four regions here. Hmm? Which is the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. And do you have any pain anywhere? Do you have pain in any of those regions? Okay, if you have pain, I'm gonna leave it to be the last thing I'm gonna do. I'm going to be percussing in a clockwise direction, still from the right lower quadrant. And in percussion, I'm feeling for vibration and sounds. Sorry, in percussion, I'm gonna be using my fingers. Yeah, so I'll start from the right. Checking for vibration sounds. Start from the next one, the right upper quadrant. Yeah, starting from the right this way. I'm gonna be percussing in a spherical way, this way in clockwise direction. Yeah, I might make a big circle. Then I go ahead to make a small circle by percussing. I'm checking for vibrations. Most times we could hear a timpani sound, resonant sound, a flat or a dull sound, but normally the stomach has a dull sound. But when we come across an organ, it could be a dull sound also. When it's a bone, it can be a flat sound. Yeah. Yeah. And I'm done percussing. Everything seems okay. Also, the next thing I'm going to be doing for you, I'm going to palpate. And in palpating, I'm palpating those four regions, okay? And in palpating, I'll start from the right lower quadrant in clockwise direction to the last one. And also, is there any pain anywhere? Do you have any pain anywhere? Any kind of tenderness? Okay, because if you happen to have a pain in any area, I'm gonna leave that side and make it the last one I'm gonna do, and it's going to be as gentle as possible. And I'm going to do a light palpation, not a deep one. Okay. And in this palpation, I'm assessing for the lungs. I'm assessing for lungs. I'm assessing for masses. I'm also assessing for the moist nature of the area, the temperature, and all of that. Yeah, while palpating, everything seems to be okay. I can't find any lumps, I can't find any mass. Temperature is normal, your skin looks moist, it's not dry. Yeah, I'm also going to palpate the costovertebral angle, and in this region, in this part, you're not going to be on the flat surface, you'll be sitting up. Okay, sorry, I'll help you up so that you can sit up for me to check the costovertebral angle tenderness. So the costovertebral angle happens to be at the level of the 12th rib. It's where the angle where the left kidney meets the spine. So it should be around here. I'm gonna be assessing it for tenderness. So that's good. Sorry. Okay, everything seems to be okay. I can't see you making any I can't see you in pain. Yeah, the next thing I'll be doing is to measure your abdominal girth, okay? And I'll be using a measuring tape for it. I'm gonna still keep you on a flat surface, and before I proceed, I'm going to make a mark on the umbilicus for future measurements, okay? So that any other person that comes can still measure at the same spot. This is to ensure accuracy. So I'm going to be measuring in centimeters, okay? So I believe this should be the level of your umbilicus. Yeah. Okay. Yeah, it's 8 cm. Okay. Thank you so much. Yeah, I think at this point, I'm done with your abdominal assessment, your GIT assessment, your gastrointestinal assessment. And do you have any other thing I can do for you? Okay, so I'm gonna put you back in the position, and I'll cover you up. Then these are your side rails where you can hold on to. This is your call bell. I'm handing over your call bell to you. In case you need anything, you can as well call back and I'll come. And I'm going to document my findings. Yeah, Mrs. Susie, after this assessment, everything happens to be okay with your gastrointestinal region. Yeah. Thank you so much. Thank you for your time. Hope you're in the comfortable position. Okay. Bye. See you next time. If you have any problem, don't forget to reach out to me. Thank you. Bye.